Hello, I welcome you again warmly to our format, Natural Medicine. Today it is about a topic that is increasingly common in society, or rather well-known cases. Perhaps you also have someone in your acquaintance or circle of friends and family, long COVID. So today we want to look at, in this conversation with Med Heinz Lüscher, what can be done naturally to restore energy and strengthen people once again. Stay tuned and be excited for interesting insights, helpful support. We start right away. Hello, dear Heinz. It's great to have you back.
Hello, Alexandra.
Dr. Med Heinz Lüscher, I'll say it again, orthomolecular physician and general practitioner. And you can see, well, you don't see, but you actually would or still follow your passion for micronutrients in your work, because you probably could have retired a long time ago, right?
Yes, I could, but that would be boring. I love this kind of medicine. I used to be a general practitioner, and what I do today, it's much more fun.
Since when has orthomolecular medicine, a difficult word, been a part of your work, or do you know it?
For me, about 12 years now. It was founded by Linus Pauling, who was a Nobel Prize winner. He started in the 70s with high doses of vitamin C. He himself took 15-20 grams of vitamin C per day. People used to laugh at him, but after all, he lived to be 93. That was quite old at that time, but today we know it makes no sense at all to give a single substance in very high doses. We need to find the balance of dozens or hundreds of micronutrients. That's what humans need.
Micronutrients are useful in many respects in all diseases to apply.
Advanced medicine, we don't work exclusively, but mainly with micronutrients. If there is a need for a medication, then that too. For me today, the nutrient medicine, which is another word for orthomolecular, is at the forefront. The medications are complementary.
Because it's also about not working against something, but supporting the body in its own production of substances.
Absolutely. I always wonder why doctors ignore the biology of humans.
Completely schizophrenic.
The auto mechanic can't ignore the engine either. It's not enough if the car doesn't run when I just repaint it. I must get to the core of the problem. We need macronutrients, carbohydrates, fat, proteins, so that the body can function at all. But it takes hundreds of micronutrients as consumers, as supplements in metabolism, so that everything can be processed. And when there are deficiencies, then I have a problem, I get sick. From my perspective today, about 1,000 diseases are not diseases at all, but deficiencies. But my colleagues virtually cannot comprehend this thought.
It almost seems as if some people might simply find it too complicated, because it's a fine orchestration we have there, right?
It is also complicated. I've almost done a second degree in recent years. I started 12 years ago. Even today, not a day passes without having to learn something new about it. Studies, books on this subject, these are hundreds of hours that I had to work through. In conventional medical training, I hear nothing about micronutrients. I must also attend those.
One learns how things then come back into play with that beautiful phrase.
But we can use this prelude now also on the topic, because that's what it's really about.
We want to talk today very explicitly about the topic of long COVID, so something that's still relatively new in this terminology.
Yes, new and yet not. We can broaden it. States of exhaustion after infections, especially viral infections, have been known to us for a long time. There are exhaustion after Epstein-Barr virus. You know that there are people who are out of action for half a year when they've had this illness. Sometimes even longer. It can occur after the flu. And now it also happens after the new virus. But that's actually something old. After such an illness, you can be completely exhausted. That's what it's about. Why it affects some and not others, I don't exactly know.
So, in principle, you can also say that the body simply lacks energy, says the round word, exhaustion.
Yes, that's where we start in therapy. But why now? I've had this illness twice and it was harmless. I was sick for a few days and then it went on. And most people experience it that way too. And why it really hits individuals hard and they can barely get out of bed, that's really a mystery. And I believe that's where research is not so far along yet, that we already really know the reasons in detail here.
You also spoke earlier about a very severe case in your circle of colleagues.
Yes, I have several such patients. They are incredibly tired, completely exhausted. That is the pattern of the illness. People are completely exhausted. The thought of working is out of the question. They can barely go to the kitchen to make a coffee and then have to lie down again. The energy is completely gone. This is a huge problem. For these people, it is incredibly difficult to get back on their feet.
So, someone who has not yet experienced it cannot imagine it at all?
Honestly, neither can I. I see how the people come into the practice. I see there's nothing left. But what it's like for these people at home, when you are supposed to take care of the family and can no longer work, what that means in everyday life, and it doesn't get any better, not even after weeks. Our experience now slowly shows us that after several weeks, maybe 3 months, it naturally starts to get better. But until the people can work again, that can take a year or more.
What does the classic medical treatment look like in this case?
When I listen to my colleagues, they have no solution. People are put off on the waiting list until it gets better. Or rehab or a stay in a clinic is recommended. But the difference is people are also tired in a rehab clinic and cannot use the offerings at all. It's really difficult. I am glad that we have found something here. It is also not a miracle method. I want to make that clear. We can provide support. We can probably get the patients back on their feet more quickly. But it also takes time and patience, even with us. But at least we have options.
When you speak of yourself, you speak of a team that works in your center. Where are you here in Switzerland?
In Winterthur, the Wise Medicine Clinic, it is an integrative clinic. Several doctors and therapists working together in a comprehensive, holistic health center. We also have a second location in Bruck, in Aargau. These long COVID therapies that we offer here are only available in Winterthur.
What characterizes the treatment concept at your place? What is the procedure when someone comes to you with long COVID?
I assume that the diagnosis is already clear. The people already know that. They have been to the GP or the clinic and already have the diagnosis. For me, it is an anamnetic diagnosis. Of course, I can still measure many things in the lab, but there is no marker. If, for example, the sugar is elevated, then I know it's diabetes. That doesn't exist here. I don't have specific markers where I see it must be exhaustion after an infection. The anamnesis is clear. The people who are sick 3 weeks or months ago and don't get back on their feet, then everything is clear to me. Then I don't do any further examinations. Now it's about, as I said at the beginning, the energy has to return to the cells. It needs a whole bouquet of micronutrients.
Okay.
Together with Professor Hockett's, we developed a product. King Nature did that. I'm always on the sidelines when it comes to product development. The product is called Recovery Box.
Or regeneration box.
Or regeneration, if you want to call it that. There are 3 substances, 3 products in it. They work together. When someone buys this recovery box, it is important that they take all 3 products simultaneously. Not one in the morning and the other in the evening. All 3 together. It contains turmeric. Turmeric has incredibly anti-inflammatory effects. I don't know if in these patients any virus is still active. With mononucleosis, we know that the antibodies are elevated for years. But are they just antibodies, or is the virus still somewhere inside and affecting them? That I don't know. Turmeric as an anti-inflammatory is a part of it. Then it has the vitality shot in it. It's a multi-product containing all the necessary micronutrients. We have all the vitamins, A, B, the entire B complex, C, E, everything is in it. We have the important trace elements in it. Magnesium, selenium, zinc, manganese, chromium, copper. Everything is simply in it. And then also amino acids are in it, and anti-inflammatory secondary phytochemicals from cocoa beans and the maca plant. These are invigorating substances. They are all mixed in there. You have a small letter. Once a day you take this powder with some water. There you have the entire supply, which the cells need. The last thing in there is called Herbal Hero. It is a mixture of various plant substances. In it we have dandelion extract, brown algae, rhodiola extract, reishi, a healing mushroom, extremely good anti-inflammatory. It has quercetin in it, maybe vitamin C, just a good mix. And now take all 3 products really together, preferably in the morning and at noon. And that for weeks. This is how we support the body so that it regains energy.
Is it explicitly only for those who suffer from the so-called long COVID, or are there also other patients for whom this is interesting?
Any form of exhaustion, even if it is a normal burnout, it also helps.
How is it, may I ask very bluntly, depression is such a present topic in our society? Is that also a state of exhaustion where that would fit well?
Would it help? Absolutely. Depression is always also associated with the gut. That has long been proven. Still in medicine, depression is considered a serotonin deficiency. That may also be true, but that is not the main factor. The main factor is a silent inflammation in the brain and a lack of micronutrients, and also a gut disorder where the nutrients are not absorbed properly. It is complex, but you can also do something about it.
Back to long COVID. I come to the practice with my long COVID symptoms and then have a wonderful product that now covers everything for me, that eliminates the energy deficiency.
Exactly, but that is only one part of the coin. I also have to increase the number of mitochondria. Mitochondria are tiny components in the cell grooves where the energy is produced. The metabolism takes place in the mitochondria. Everything I've listed now about micronutrients is processed there in these mitochondria. But if I have too few, then I won't get far either. If I have too little gasoline in the tank, the car won't go far either. And it's the same in the body. I need to increase the number of mitochondria so that the overall energy increases. We achieve this with the ISST treatment. There are other programs about it. It is a technical treatment. The patient lies on a bed, receives a mask, and the machine regulates the oxygen supply. Sometimes too little, then again too high, alternating. The oxygen amount varies. This corresponds to altitude training. That's the trick. When athletes prepare for an Olympics, they often go for 3 weeks to St. Moritz at an altitude of 2,000 meters. This improves their energy, it increases the number of blood cells. When you train at altitude, you experience a lasting effect of more energy. We can simulate this with this IHHT treatment. That's a bit laborious. You have to do it between 20 and 50 times in such states of exhaustion. That's tough for the patients, especially if they don't live right around the corner. We had few exemplary cases that bloomed after just 7 to 8 times. Those are rather the exceptions. The average is 20 sessions. Then the people are fit again. The recovery box provides the fuel, the nourishment for the mitochondria. That's how the energy returns.
That's a combination where I don't question whether it's worth the effort. For a person who's already exhausted, it's twice as hard.
You have time when you're not allowed to work.
Ideally, you have someone who accompanies you and who cares and motivates you to do it regularly. But you have good prospects with it?
Yes, I sometimes marvel. I could really tell stories where people went back to work after 10, 12 sessions who were previously unable to work, maybe only 20-30% performance, and then they can practically work normally again.
The key question is, will this be paid for by the insurance?
Of course, as always, no. I have heard that in Germany it is now being paid for with this diagnosis. Not yet in Switzerland, but it makes no sense that it is not paid for, because all other offers are much more expensive. Such a session costs about 100 francs. With modest effort, I can restore these people.
If there is a prospect of eliminating this miserable condition, then you shouldn't save at the wrong end. Not just because the health insurance doesn't pay, then I can't do it. That's such a typical victim mentality. Ultimately, it fits the disease pattern again.
Yes, that's true. We still have one last possibility, which is infusions. There are infusions in which these trace elements are also included, so-called mitochondrial mixtures. There are amino acids, carnitine, vitamin C in it, really good mixtures, but they are more expensive. That quickly costs a few hundred francs, such infusions. Of course, you have to do that 5, 7, 10 times. That tends to cost more. But if we don't achieve the goal, if we have the impression that after 20 IST sessions the patients still aren't doing well enough, then I recommend such infusions. Now we have the full load of mechanical nutrients directly in the body. We are not reliant on digestion, the absorption in the intestine.
I just wanted to ask, what is the difference, or rather what is the advantage of the infusions, so the faster availability?
Yes, just the faster effect. That's it? Yes.
Now you are a center, a medical center that looks at people holistically, so very comprehensively. you will certainly not only focus on the exhaustion states that the physical body shows here, but also on the influencing factors in this person's life.
Yes, someone who is so down physically also has to struggle mentally, so very normal. It is important that we also talk about their situation. I can't change that. But for many people, it is already helpful if they are allowed to express themselves. We know that from psychology as well. When the patient could just describe the stress, then people say, I feel better already, even though I haven't said anything yet. But that's why it takes time. And medicine where doctors' time is taken away is a lacking development.
Yes, and unfortunately it's the case that when I am at home, assuming I even have a family and someone to talk to, many are just simply alone or lonely. But even if I have a family, the family might then also be overwhelmed with me and my problems, and then I might also start talking about how bad I feel, and everyone has to ensure that they energetically stay in their own good balance.
You know, the expression exhaustion, depression, exhaustion, depression. That is the common term for a burnout. But the depression only comes afterwards. A burnout is not a depression. A burnout is a physical exhaustion, no matter what the cause is. It is also a post-viral exhaustion, physical exhaustion, and I also felt that way when I was in for 4 weeks, lying in bed and having no hope of recovery. Then I would probably become depressed too. But it is not primarily a depression, rather it is a secondary depression. And that's why antidepressants are not the right thing for me in this case. I have to rebuild the body, maybe also the psyche. But I can also do this with conversation and by giving courage and speaking words of reassurance. But the body needs its nutrients to regain strength.
Because antidepressants also have side effects. When I talk to those affected, I always think, oh God, it's almost like exacerbating something that you are doing there.
Yes, that does exist. I also have patients who tell me, ever since I've been taking the antidepressants, I've been feeling much better. That does exist. But others also say, I've been taking them for 6 months now, and they've had no effect at all. That also exists. It varies greatly. But unfortunately, it does have side effects. And that is primarily weight gain. And for some people, it's just like an intervention in their personality. They are no longer themselves. That's obviously really bad.
Yes. So we have the micronutrients, we have IHHT as a treatment concept, and then also the infusions. Depending on the situation, the infusions are only used, as you just said, when IHHT then...
Yes, in the end. Because ultimately PQs of the cost. And of course, also an infusion, you get pricked. Then you're there 1.5, 2 hours hooked up to an infusion. That's really, for me, the last resort. But sometimes it needs to be done.
Can I, if I'm now affected, act on my own accord there? This recovery box?
Yes, the recovery box at home, that's possible. You can order it from the Green Nature web shop and then do it like that.
And then you could start with that and see, yes, absolutely. That's just the chance when it wasn't too serious, when the exhaustion was partial, say, you can still work 50%, then it's enough to take the 3 products from the recovery box. And where do I get them?
King Nature, that's the company, the website, kingnature.ch. They are, and just call up the web shop, and there it is, recovery box.
Is there also one for children?
Yes, children have half the dosage.
Yes, of course, they logically have. One thing interests me, because with medications, it's always said they are actually more based on the requirements of a man. This criticism is well known by now. How is it with the products?
No, micronutrients that has nothing to do with gender. That has more to do with body weight. So someone who weighs only 45 kilos surely needs less than someone with 100. That much is true. But men, women are treated equally.
If the provider has it, then there is also advice available, a telephone consultation, I can imagine.
Yes, there is.
If I'm a little unsure, what, how?
Of course, no company can everyone who buys a product advise. But if you really have serious questions, you can call there.
Okay, good. Then I think that's a good offer, or a good concept.
I'm happy, Alexandra. We have many patients exhausted for some reason, and they're much better.
Exactly, for some reason. Not just long COVID. So, great concept. That's why there's no need to bury your head in the sand and say, I'm just going to wait now until it's over with me, and I just accept the condition as it is. No, of course not. So we're kind of smiling about it now, and maybe someone who is affected is sitting at home and has this exhaustion. But then you are definitely in the right place here. Here, there is a good concept with good prospects. I thank you at this point. We have already reached the end of the conversation again.
It always goes quickly.
Yes, exactly right. Thank you very much. Is there any clue missing regarding long COVID where you say,
no, those 3 points are the most important?
Okay, wonderful. And of course, you also have to motivate yourself to say yes, well.
Yes, that is probably the biggest problem. Someone who has no energy left to then call the practice and come by. That is the power of overcoming.
But if necessary, maybe just address a family member who supports a little, is active, and perhaps clarifies one or the other if it is relevant.
Yes, we have patients who are brought in every time, or from someone in the family.
Wonderful. Yes, then all I can say again is thank you very much.
You're welcome.
I am always happy to have you here and to talk with you about these things. Above all, because you do it with so much passion, you can feel from your talking that you are really interested in health.
Exactly. I like micronutrient.
Yes, exactly. Well, such a philosophy and attitude is not found everywhere. So thank you for your work, for your mission, and I hope it spreads greatly further and into the future, because micronutrients simply receive far too little attention in society, in medicine, in any case. But you are doing your best.
Exactly. That's why we have such shows, so many people can hear it.
Exactly, so we can inform about it. So once again, thank you very much, and thank you very much to you as well. And I hope you get an idea of how important it is, even if you are healthy, that you support your physical body, that you contribute with micronutrients, so that your body can continue to keep you as healthy as it is actually an aspiration by nature. In this sense, please stay healthy. And if you're not, please get well very quickly. We have made a support offer, and in this sense, I remain until next time and look forward to having you with us again. Healthy, hopefully. Until then, goodbye.